Now, it's my understanding that you came here to see me today as your neurologist because you were referred to me by your primary care provider, Dr. Bond, after having some trouble with your vision being blurry. You have occasional numbness and tingling and weakness in your arms and legs. And I also noticed that you said you had a hard time balancing. Is this right?
Yes.
Okay, so after doing some clinical and laboratory tests along with a neurological examination we completed just a few minutes ago, it is my determination that you have multiple sclerosis, which we sometimes abbreviate as MS. So let me explain to you what multiple sclerosis is first. It is a chronic disease that affects the central nervous system. So your central nervous system is essentially made up of your brain, your spinal cord, and the optic nerves, which are the nerves that essentially project to our eye that allow us to see.
Okay.
With that being said, everyone has an immune system that fights off diseases or bacteria or viruses or any sort of infection. However, sometimes the immune system mistakes the brain or the spinal cord and the optic nerves and attacks the nerves of each of them because they think that they don't belong in the body and they become damaged. So our example of our analogy that we like to use is basically an electrical cord plugged into a light socket. So the light socket is the brain, and then the electrical cord is the myelin sheath, which are the nerves. And they have the covering of the nerve, which is called the myelin sheath. And so when the brain is trying to send out signals through the nerves, and the nerve becomes damaged from the immune system, it's hard for that nerve to communicate with your arms and your legs or your vision. So it becomes damaged. Kind of like if someone ran over a cord, it would become damaged and your brain would have, or the light would have a hard time turning on.
Okay.
So let's go over what we're going to do about this and how we're going to treat it. The key to successfully treating MS involves working closely with myself and Dr. Bond, who's your primary care physician, and some other specialists who will be referred to you if needed later on, but that's not important today. Medications, therapy, proper lifestyle choices can help ensure that MS remains only a part of your life and it's not the determining factor of how you should live it. So with that being said, almost all of the therapies are generally safe and well tolerated. So I'm going to put you on an injectable medication, which is called Tysarabi. You will have an injection done every 28 days. You will come and see me for the first injection, and everyone following that, and you would do yourself until you feel comfortable. So there are 3 things that I want you to work or focus on in order to maintain good health. Starting with your diet, because you are diabetic, we are going to put you on an even more specialized diet than the common balanced diet, which is the low sugar and fat diet you are on now. The medication, which we are giving you, will make you very dehydrated, so you will need to drink lots of water before and after injections. You need to adjust your diet to one that is low in saturated fats by replacing them with other things. So we are going to have you follow up with a nutritionist that can help you with a meal plan. I'm also going to follow up, I'm also going to prescribe you to vitamin D tablets, which you will take every morning when you wake up with a full glass of water. It's really important to remember to complete all these things, or at least try to, for the first few months. The better you take care of yourself, the better you will feel. So following up with your nutritionist will help you have less relapses or attacks, and that's when you feel the numbness, tingling. We call those whatever you like, relapses or attacks. Staying hydrated will help you feel less fatigued after injections. The research is new on MS patients taking vitamin D tablets. However, researchers are finding vitamin D may have important effects on the immune system and may help you regulate cell growth and differentiation. With all that being said, I'm sure you have lots of questions, but do you have any questions for me today?
There are no surgical procedures involved right away, correct?
Correct. Not as of right now. And typically, in the long run, even years down the road, there's typically no surgical procedures that need to be done.
So the 3 things I need to do are drink a full glass of water with my vitamin D tablets.
Every morning.
Before and after injections, drink lots of water. And then also follow up with a nutritionist and change my diet.
Correct. And we are going to schedule your first injection right away. So we'll get you scheduled for that. Any other questions?
That is